Premier Ford made a major announcement today aimed at dealing with the big staff shortages we've been seeing in hospitals. His idea, essentially, to poach healthcare workers from other parts of Canada.
Welcome you with open arms. You won't have to go through any bureaucratic red tape. You arrive here with your credentials. We'll find a job immediately for you.
Ford says the government will introduce legislation next month that will let Canadian healthcare workers registered or licensed in other provinces start practicing in Ontario immediately.
A doctor from British Columbia or a nurse from Quebec who wants to come and work in Ontario shouldn't face barriers or bureaucratic delays to start providing care.
Currently, healthcare professionals have to be registered with one of Ontario's health regulatory colleges before being allowed to work in this province. This move will loosen the rules, and it's not sitting well with the Ontario Nurses Association, which tells me it wasn't consulted on it.
This is very concerning that regulated professionals will not have to regulate anywhere. How do you ensure?
What's concerning about this? Aren't the other provinces doing due diligence to make sure these people are up to snuff?
Well, there still is an accountability to ensure that they're registered, that they are regulated, and that they are accountable for the care that they provide.
Out-of-province doctors could start working immediately, though they would still have to register with a college in Ontario. They'd have a year to do so. This move comes just days after Ford announced a plan to boost the number of surgeries and procedures performed in private clinics, something critics worry will drain staff from the public system. Ford today was putting on the hard sell, it seemed, to try and get out-of-province workers to come to Ontario.
If you've been thinking of making Ontario your new home, now's the time to make that move.
Every province across this country, particularly in nursing, is struggling with a nursing shortage. So we're depleting in one place to come to another place.
Ford didn't stop there. He also announced that the government will allow healthcare professionals like nurses and paramedics and respiratory therapists to work outside of their area of expertise, quote, as long as they have the knowledge, skill, and judgment to do so. Government officials told CityNews an example of this would be a nurse being allowed to order an X-ray or a test instead of a doctor.
Our ask would be is invest in nurses and the healthcare professionals you have here in the province and use that money to ensure that the people that have left come back and the ones that are here are retained.
Ford says there will be no incentives for out-of-province healthcare workers to move to Ontario. And critics claim the wage cap Bill 124 has made the province one of the least desirable places to work in Canada for healthcare professionals. Richard Southern, City News.